Thank you so much for jumping on today. Appreciate you being here, whether you're logged onto Zoom or you're calling in on the phone or you are watching on Facebook. Hello to everybody. A few housekeeping items. Your cameras are off and your lines are muted. So if you have any questions for us, please type those questions in at the Q&A section at the bottom of Zoom. We will do our best to monitor that. If you are on Facebook, you can also type your questions into Facebook and we will answer those questions as we're able. We're just going to get started. I'm going to introduce myself. My name is Kim Brackey. I'm Regional Sales and PR Director, and I'm based in, today it's very sunny, Pierre, South Dakota. 2 weeks ago, it was snowing and we got 6 inches of snow. So gotta love the South Dakota weather. And we've got a great panel on today. So I'm gonna let them each introduce themselves.
I'm Dr. Morehouse. I'm Chief Medical Officer of Edgewood Health. I'm actually based out of Meridian, Idaho, a suburb of Boise, Idaho. And the weather is really nice today.
Hello, everybody. I'm Michael Johnson. I'm the Chief Nursing Officer for Edgewood Healthcare. I'm based out of the corporate offices in Grand Forks, North Dakota.
Hi, everyone. I'm Barbara McMahon. I'm a wife and mother of 6, and I'm on because I moved my aunt into assisted living during COVID.
Oh, Jean, you're muted.
Hello, I'm Jean Hill. I'm calling in from Minneapolis. I'm one of 6 children. We moved our mother into Edgewood and Fargo in July.
Thank you so much, everybody, for those intros. Today's topic is about moving in or moving during COVID. We know that everybody has questions, concerns. So we are going to have our great panel of experts today talk a little bit about their experiences, their knowledge, what we're doing with Edgewood, but really as a whole, what everybody can be thinking about with moving their loved one, whether it's into Edgewood or somewhere else, another senior living during COVID. We've got some really good information for you today. I'm gonna have Dr. Morehouse kick it off with us and just start to do a little intro about his philosophy or his thoughts on what's going on.
Well, thank you. I'm happy to be here today and excited to talk about these topics. It's on everybody's mind. COVID is in the media quite a bit for the last year. It's kind of taken up our whole year. COVID is a virus that came from China, and we heard about it back in December of last year, and we didn't know what it was, and we weren't sure, but we knew that it was significant. And I was like everybody else back in January and February, where I'd come home and wasn't sure if I could even be around my wife or what we could be doing, and we didn't know much about it. So we started to try to figure this out the best we can, and testing methods. As everybody knows, testing has been an issue from day one, just access to testing, and are the tests accurate? And the media has played a role in this, showing pretty much the awful side of it, but we've learned a great deal. We started testing in the Edgewood Assisted Livings. We started testing back in the first week of March and testing all of the employees. We felt like this would be the best way to screen and keep this virus out of our facilities and keep our residents safe. As we know, the elderly population is at the highest risk, and so we feel that that is our precious cargo, and we want to take care of those individuals. And so we started testing early on with the antibody testing. That was the only thing that was actually available to us at that time. The PCR testing was suggested, but the problem with it is you could get tested, but you wouldn't get the results back for 2 weeks, and that wasn't really good medicine, actually. But we've learned a lot from it, and we've been able to keep it out of our facilities for the most part in the early part of this. And now you see these spikes across the nation, and it's troubling, but there is a positive side to it. The positive side to it is we've learned a lot on how to treat this. There are several different medications that we're using. Also, supportive care and access to those types of things have become better as time has gone on. The whole point of this deal with the COVID was to stop the curve or flatten the curve. And what that meant is we didn't want to overwhelm the hospital systems because we don't have enough bed space if everybody gets sick. And we did a pretty good job of that, where we didn't have this rush and overwhelm the hospitals. And so now what we're seeing is little upticks here and there, and we don't like it, but it is what it is. But we've learned to deal with it, and we've also learned to deal with it within our own residents at the assisted livings. And so it's we're able to treat the individuals in their own home for the most part. I would probably say upwards of 95% of our residents with good success rate. So the other part about this is moving into an assisted living during a time of the uncertainty. And I would argue that it's a good a time to move into assisted living as any other time. The practices that are being done during this in the assisted living is aggressive. They're following all the CDC guidelines and state public health in each state. It's interesting how it's a little bit different in each state on what's recommended, but for the most part, that's being practiced by Edgewood. The testing is more accessible. We are able to get tests where we can get results in a timely manner. Isolation protocols are being done, and we're still able to have cares in the facilities. And I think that's one thing that if you're looking to move your loved one into an assisted living, some of the questions that you should be asking is, what if they do get sick? How do we take care of them? What kind of services are available? And I know the biggest one that everybody's been working on tremendously is the interaction with your own family members because of the isolation. We understand, if my mother was in a facility, I'd want to see her too, but I understand the risks. And so that's being done on a day-by-day basis on how we can open up and be safe about seeing our loved ones without exposing anybody else. And with the rapid tests that we have, this is going to be able to open those things up. I know, for instance, the residents, when I talk to them, just getting their hair done, the beautician to come in, things like that, we had before, and we had to shut all that stuff off, but we'll be able to get those things back on track just with testing and being able to take care of our loved ones. So I would reiterate, when you're looking to move your loved one in, you need to ask of that. What's the communication like, and who's taking care of our loved ones? If they need to go to the hospital, how is that done? Are you able to take care of them in the home? Not all facilities are able to offer that. Can you do therapies in the home? So those are the questions that should be asked. And I suspect in the future here, we are going to continue to see these spikes for quite some time. But with those spikes, we're also getting better and better treatment options. I know in some of our facilities, some of the residents have actually received the immunoglobulins at the hospitals, and they've done really well. For the most part, just the supportive care of having oxygen on site and fluids, able to get IV fluids in their own home, has made a huge difference for our residents. And we're going to deal with this and continue to utilize the ancillary services and take care of our residents in the home. And we will see this uptick here and there, different communities. We've seen that. What's interesting so far, the pattern that Michael Johnson can confirm with me is we saw an uptick in Boise about 3 to 4 weeks before we saw anything in the Midwest. And that pattern tends to hold true now. Every time we see a spike, if we're getting one out here in the West, the Midwest follows right behind about every 3 weeks. And so we are seeing trends and things and getting services ready to combat that. But I know how hard it is to take care of a loved one in your own home. It's a lot of work, and being able to get into an assisted living and get services and get them acclimated, and they usually thrive in those settings more than they do in your own home, is what I've seen in the past through my experience. And right now is just as good a time to move in as any other time. But you should be asking those questions. What are the safety measures? What are the protocols? And can we interact in the communication, and what services are available? That's what I got, Kim.
Thank you, Dr. Morehouse. I think one thing you brought up that I hadn't thought about, I have thought about a bit, but is getting your hair done and thinking about if somebody does live in their own home and they just happen to go to a salon just down the road, how any salon in any Edgewood or non-Edgewood assisted living, skilled nursing, those salons are really going by protocol as far as wearing PPE, sanitizing. If you just go to a regular salon, you don't know who you're going to be interacting with and if they're following any of that. So I just thought that was a really good point as well. Getting your hair done makes everybody feel fabulous, I think. I think, so Dr. Morehouse talked a little bit about moving in a non-COVID or during COVID. So we are going to have, first we're going to invite Jean to talk a little bit and share a little bit about her experience of moving a loved one into Edgewood Fargo during COVID. And so Jean, I'm going to just let you take it away and share your story.
Thank you, Kim. So as I mentioned, I'm one of 6. My lovely mother is 84 years old. We started our journey in looking for what her next home was in about January. We were contemplating assisted living. We were also contemplating in-home care. Being outside of Fargo, it was my job to do the research, and did a lot of research about in-home care, did a lot of research about assisted living, and I procrastinated a little bit. And so I finally got back into it in about March. And by that time, we were aware that COVID was really a factor. So my research then took me to the Department of Health to look how the different facilities in Fargo were managing COVID, because that was truly a big concern of ours. And so research was a big part of our journey. But unfortunately, in March, then things were being shut down. We could not go into Edgewood. We did have an aunt who was in the facility in the past, so we were familiar with Edgewood, but we couldn't go into the facility. So it was but we had decided that was a facility that we thought was best. My husband came up with the idea to put together mood boards so my mom could look at those to know what her next home was going to be about. But Kelsey, the PR director in the Fargo facility, one-upped us. She had an even better idea. She put together a wonderful 3-ring binder all with pictures and lovely cards and well wishes from the staff in Edgewood. So that right there showed us we've made the right decision. They already care about my mom, and she's not even there yet. So then we had to be patient, and we wanted to be patient because of this disease. Think back to March, we didn't know so much of what we know now. So we were patient, and then we got the call that they were ready. And one of our concerns when they were ready was the quarantine. So I wanted to give you a little bit of advice if you are making this and thinking about moving your loved one into facility, is the 14-day quarantine is something that concerned us a lot as far as just the transition for our mom. So we put together a calendar, and we made sure she had someone visiting her every single day of that 14-day quarantine. We thought that was very important. And we were fortunate, as I mentioned earlier, it was July, so we could do those visits outdoors. And we just felt that it was a good way to transition. We moved my mom in on a Friday. My other bit of advice is don't do that. Why? I had a panic attack about noon on Saturday. What is she doing? I don't have eyes on her. And I didn't have Kelsey to call on a Saturday. So my advice is just if it's possible, move in on another day. But even though it was Saturday and I had that panic attack, I did call. And I would have called Kelsey, but I called and I felt very listened to. I felt very, my questions and concerns were answered. They even called back with more information. So every step along the way, there has been hand holding. And I'm one of 6, so I'm sure that the other 5 were also doing similar things. But one of the things with our family, we have had a lot of these Zoom calls to make sure we were all on the same page, make sure we all understood, and all the protocols in place that Edgewood had for COVID just reassured us all along the way. Our mom is a very social person, and I think you mentioned to Dr. Morehouse about the adjustment. Just last Friday, we had proof that her adjustment is going fabulously. My brother in Fargo was set up a FaceTime call with me and my mom for Friday afternoon. And when it came time for that FaceTime call, she was nowhere to be found because she was off at happy hour. So I never got to see her, but that's to me proof that she's settled, having fun, living her life.
That is awesome, Jean. I was actually going to ask how mom's doing, because July's been a little bit, and she was off at happy hour. That's wonderful to hear. Dr. Morehouse, Michael, anyone have any questions for Jean before we have Barb kind of introduce herself and do a little bit of her story? Or I know we had some questions for Jean the other day. Okay, we'll wait. We're going to come back to you, Jean, in a little bit. I want to introduce Barb, and I want you to share a little bit about your story in Sierra Hills.
Thank you, Kim. I experienced a lot of similar things. The situation with my aunt at the start of COVID, where we had already done our research. I had asked her, my husband and I are in charge of helping her in her later years. She'll be 90 years old in December, but she's a very independent person, has lived independently all her life, never married, was an obstetrics nurse for 50 years. So she had all the answers and she knew everything. And she knew if she moved that she would decline. And so we were up against a lot, and we started last year and finally just trying to make her feel like it was her decision. And she had a lot of friends that were supporting her and staying in her own home for a long time. Then it became apparent she had to stop driving, and she's now legally blind. And she has a severe loss of memory, short-term memory, for about 3 years now. So we felt like we were working against the clock as far as letting her stay in her own home. She'd already told us, I'm never moving. I'm going to die here. This is what I want. And yet she had put us in charge of taking care of her in her elderly years. So the situation, the scenario that was her living alone and very independent, and a woman of very strong faith, said to us, the Lord hasn't told me to move. So it put us in a hard position, but it was more of a walk of faith with us, because we knew if we needed to take care of her, we needed to take care of that she wasn't alone. So it was the start of COVID that actually set the stage for the needs, all her friends that were keeping her in her own home. Suddenly they couldn't anymore. There were 3 women taking her to church, taking her shopping. One woman did all of her finances and reconciled her bank account every month. They paid all of her bills. They did everything for her because she was legally blind and now couldn't drive. But now all of a sudden, these people could not take care of her. And our options had run out. So the volunteers, the friends, said they were screaming to the family for help. Please, we can't keep doing this. Somebody talk to Aunt Virginia. We tried other avenues, someone to live with her, but we couldn't get anyone hired. She kept thinking that she was going to charge them rent. So we could see that some of the dementia had started in. And instead of trying to convince her that she's wrong, that we have to move her, the best thing for her now is combating her thinking, was to just actually hope and pray that the Lord would set the stage, that she would see in her own mind it was time for her to move, and that it was best for her. And her doctor was on board, that she knows and loves and trusts. And so 3 of the siblings, 2 of my siblings, met with the doctor, and the doctor said, Virginia, this is a good place to move to. She had an opportunity to actually view the room, which was important to her to be in the room and visualize where her furniture would go and where she could place them. And then so that next day she had thought about what the doctor had recommended, that this was a good time for her to move, and that it would come together for her. I had not told her that I ordered the moving truck for the very next day. We were hoping and praying it would just come from her thought. That I came back to her house and said, this is a great place and it's an open studio apartment, ground level. You know, she knew she's going to have a place where she could memorize quickly. And I said, it's the only time we've got to move. The quarantine will be 2 weeks. Well, let's just push past that. And she said, yes, I think it's time for me to move. And so that night before going to bed, she was actually packing her own things and getting ready. And the next morning she had already forgotten. She would leave a note in the bathroom that said what day it was. But I also noticed that the next note next to it said moving truck here at 11 a.m. So I knew she had read that and remembered that's coming up. So she had taken part in participating in the decision making, but the move part was the hardest, the day going in, and that she had to go in without us. But Amy was there and said, Virginia, you're going to be fine. Barb's got to stay here because of restrictions. And actually, I think that the 14-day quarantine ended up being a blessing, because it was the transition that Virginia needed, that I needed to let go of the control and pampering her and placing her things and being there for this and that. She felt her independence kick in. She did all of the adjusting with the staff there. She memorized her room more quickly because that's all she was in that room. She wasn't sick of that at that point. You know, we did our window visits and she felt loved, but she felt cared for. And yes, she did decline and she told the staff that, but that was May 12th. And now she's got her life back. She's living, she's happy. She's got her little group of people that she prays with, that she shares her faith with. And her short-term memory has also been a blessing because it was difficult. There's no way around it. It's a difficult move, especially during COVID. But I could see that the same as Jean, the staff there was already caring about my Aunt Virginia before she was even there. And it was a trust issue. And there were a lot of times when Amy would just have to say to me, Barb, you've got to trust me. And I had to. And she was trustworthy. And the staff there is trustworthy in taking care of her. The therapies are offered at assisted living. I mean, she was living alone. She was in isolation and starting with paranoia. And now she realizes, and she said to me, yes, I'm happy I'm not alone anymore. I'm in my own room, but I have family, I have friends, you know, and she feels part of the community. All that happened in less than 3 months. So I was so glad that the move was behind us, but there are countless blessings, and Sierra Hills was to her the right choice.
That is such an amazing story to hear how well she's doing. Is she utilizing she's utilizing, sounds like, some of the therapy there. What therapy services is she using?
Well, she already has been taking part in physical therapy and occupational therapy, but with the insurance, they had to come from outside. But it was with someone that she was doing therapy with in her own home for a while. So she knew Jason, she trusted Jason, and he went above and beyond and would take her around. She's legally blind, except for peripheral vision. So he would read the names on the doors, and she wanted to see, because she grew up in Cheyenne. And she knows everybody there, but she's like, I just don't know any of these names. But now people have moved in. She's got a very close friend there now that she knows well. Other therapies now, she's her doctor. They take her to her doctor appointment, and I can meet with her there. And we get a chance to visit a little bit there, 6 feet apart, or on the patio there, you know, masks on and everything, but it's always been adequate enough for her and enough time. And the doctor wanted for her to start eye therapy. So and sometimes I get to where I'm feeling, I just don't know what's going on. I feel like I've lost control. Like, I hope she's okay. And every time they've dispelled my doubts and my fears every time. And that she's fine and that she's sojourning, and the memory even has come back a little bit for her. She knows her surroundings well, and her quality of life is up from where she was before living alone. Yeah.
That's so wonderful to hear. We have one question. Vicky's wondering, is your aunt in memory care or is she in assisted living?
She's in assisted living.
Okay. So maybe to help answer for Vicky or anyone else that's wondering, residents can have dementia and still live in assisted living. It just depends on where they safely, and Michael, I'll let you talk a little bit about that, maybe about when we feel as though they're safely able to be. We have some things that we meet with the family and we meet with the resident to determine. So I'll let Michael speak a little bit about that, but that is a good question because somebody with dementia still can live in our assisted living. Michael, can I turn that over to you to explain that a little bit?
Sure, happy to. So, and yes, that does happen. People who reside in our assisted livings can have dementia. I work and lead the Senior Living Health Services Division, and we have one motto, and that is safety trumps all. So residents who are moving in are evaluated by a registered nurse who's communicating with primary providers. We're conveying information about current situations with any resident that moves in, and a determination is made. We use a few assessments and things like that to help us conclude the least restrictive environment that's appropriate and safe for a resident. So I think we all know that dementia is unfortunately a progressive process, and we do have nurses out there who are watching, which leads me to one point I wanted to make after listening to these family member talk in their updates on how important, no matter what phase of this journey you're in, whether it's an admission or during their care, with changes in condition in their care, how important communication is. Jean mentioned that, and Barb as well, slightly different terms, but it's so valuable here in these situations. But it is entirely possible to answer the question for residents with dementia to live in assisted living. Another thing that I just wanted to point out in this commentary, one was the communication. And one thing that Barb had mentioned about the 14-day quarantine, in her opinion, being a bit of a blessing at the time. And I just wanted to mention in my 14-year history in working with senior living, I can't tell you how many residents I've admitted either into assisted living or into a dementia care unit. And many times the nurses that I work with will recommend that to families that, certainly will have your apartment set up by all means. We recognize that this is a difficult and challenging situation for everybody involved, usually has a fair amount of anxiety around it, but we would encourage family members not to be in and out of the building a lot and kind of allow the resident a little bit of time to acclimate to their surroundings. I do know from visiting with many families that they had many heartfelt concerns about doing that. But really, what I can say is that the residents do transition remarkably well when they have dementia. And so even prior to COVID, that was a typically recommended practice, and for a good reason. It did allow residents time to acclimate, time to develop internal relationships, time to understand the services that are available to them, and they actually flourish. So I just wanted to bring that up after hearing these two ladies talk. So,
Michael, there's a couple questions if I can. I think you'd be great to answer both of these.
okay.
Naomi mentioned how Jean and I believe Barb have both talked about their loved one, mom or aunt, being in quarantine and being able to visit. Would you be able to explain what our quarantine that we've talked about, what that looks like? That's what Naomi was wondering.
Okay. So what I can say, because we are operating in 7 different states, it may look slightly different depending on the location. So we're obligated in any state to follow federal, state, and local public health expectations for move-in and quarantine and what that might look like. So one state, Idaho, comes to mind, does have a compassionate care element built in with their admission process. And they actually encourage, following a lot of safety standards, some random visitation that's allowable during that quarantine time. It's a little different in other states. But we do, if we can't do an in-person visit during that time, we have life enrichment staff that's available to help residents with electronic visits. Luckily, we've been blessed in this neck of the woods with some fairly moderate weather. So window visits are certainly allowable, and our nurses are working hard during that quarantine time to ensure that the space that resident is isolated in is safe, because our goal is to get them moved on from that safely and into this new normal that we're all facing. So
wonderful, thank you for that. Naomi was specifically wondering about South Dakota, but maybe you can type in some more details on South Dakota. With being in the 7 states, I know that that's where it gets tricky.
Yep.
She added that in after.
Okay.
Jody had asked, and again, I think Michael, you'd be a good one to answer this. Are there any solutions to staff shortages with staff out due to COVID?
Yes. So obviously, throughout healthcare, in again our new normal, staffing, having available physicians, nurses, and frontline staff available is challenging. But we worked very hard. Dr. Morehouse mentioned that we've been dealing with this for nearly a year now, and one of our primary tools that we put together early on in anticipation that this could grow is a contingency plan. So every community, as back as early as March, was required to put together a staffing contingency plan. Again, that's a bit of a variety pack of opportunity depending on location, but we use internal staff, agency staff where it's available, to keep minimum staffing patterns where they need to be.
Thank you for addressing that.
Yeah.
I was going to ask Barb and Jean, just to go back to the family, before we dive into some of the stuff you were going to talk about, Michael. Jean, I know your mom being at happy hour and not being available is a great thing. I would just love to know from both of you guys, though, what has been, other than seeing them kind of come back to life and being social again, can you pinpoint one time or situation that you've been able to really identify as seeing them really thrive in their environment? Is there anything specific other than the happy hour or just being with friends and praying again? Barb, you mentioned that. Or is there anything else that you guys can each think of?
I think 2 things, but I don't know if they weren't momentous, but 2 things. She loves getting her hair done. And as Dr. Morehouse mentioned, it really is a treat for her, a treat that she hadn't given herself for years when she was living on her own. So I loved that she was doing that self-care. And I love that she told me she was walking down the hall and the stylist said, "Jane, let me do something with your hair." So she even knew my mother. So I loved that. The other, my mom was talking about how she was doing some crafts, and she was explaining that to me. And she's always been very crafty, sewed all our clothes for us when we were growing up, knitted, and all very crafty. And so I love the fact that recently she's taken on painting when she was at her home. I love the fact now that she has the opportunity to do that and socialize at the same time. And she talks proudly of it.
That's awesome. Barb, do you have anything that you want to share?
I guess what I do have, one last thing is, I told you that my aunt is very independent, and she always has been very strong-willed, but she's loved her family, and she misses her family. She misses like seeing them or have them in her room, and she knows that will come someday. But meanwhile, she still has her independence, and that's really important. And Tom and I, my husband and I, are just so thrilled that it unfolded the way it did. And we had the encouragement when we did to move her in, because you hear so many stories of, I mean, she was not doing that well. It was a matter of time before she fell because she's legally blind. And I didn't want to have to come and move her from the nursing home or the hospital into a nursing home through those situations. So I feel like to share the importance of being proactive. You know, every loved one is at a different stage and you have to assess that. And we had exhausted our other options, like even having someone live with her, or we tried really hard to get assisted, what's it called, home health care in, which is very expensive. But she would not have these strangers in her house. So every situation is different, but it's time to think about it and pray about it and be guided and to act on that, because you get that help and it should be an option instead of waiting back and waiting for the situation to get so bad. You say we should have done something back during COVID. We should have done something about this, because it only does get worse. Aging is aging. And
Bring up a good point, Barb, that sometimes people aren't sure where to, when to draw the line, because sometimes it gets hard to see what's actually happening sometimes.
But to love them, to love your loved one, it may be a tough love and a tough decision, and try to get them to feel like they made the decision like we had to in our case. But it is possible, and I believe we found the right place for her, because I couldn't have done it without, like, Amy. I couldn't have done it. She was the one who kept us going, and we got past that first day and just built on that. But I'm so glad we don't have to look back and regret, why didn't we do this sooner, or we should have done it before she fell and hurt herself or something like that. Yeah. Does anyone have any questions?
I don't have any specifically for you right now. I've got a couple. Got one I want to ask Dr. Morehouse. That in the questions and answers, Dean was stating that they're assisting a World War II vet and his wife in retirement. They have selected another community only to find out that they have needs that are not met. With that in mind, would you recommend a thorough meeting with retirement communities while both of us have our full faculties? Is that something that, what would you as a physician, Dr. Morehouse, recommend for Dean?
Yeah, I think you would have if I understand this right, they're at a facility and they're not getting what they think their loved one should be getting. I think that's the communication thing we've been talking about. I think you have a meeting with them and you need to discuss the expectations. And I will tell you, on the other end of it, I take care of long-term care patients too in the nursing homes, which is different than an assisted living. And sometimes the expectations of moving into a place isn't what is there. It's just not there. And the communication and having a family council with the administrators and the staff and have a plan. You should have a plan that's discussed with the facility to know what's expected for your loved ones and what they can offer and what they can't offer. Sometimes these places are restricted by state laws and regulations. They can't offer certain things. You know, I'm going to touch back just a little on Barb's stuff and Jean's. This is probably the hardest decision I see in medicine amongst families, is deciding what to do with your loved one. That's a tough thing. You know, you promise your mother that I would never put you there or here or there. And the experience that I've had as a clinician is the loved ones usually thrive in these facilities because they're getting the help they really need. And it is so taxing on a family to try to do it at home. It's hard to do it at home. 24/7 care sometimes is just exhausted. And sometimes it's a husband and wife, and one of them suffers because they're working so hard to take care of the other one. But if they need just a little bit of assistance and get that help, it makes a world of difference. And I realized a long time ago, my job in the elderly is to help them preserve their independence. I can't fix some of the things they have, and age is an issue. Age catches us. And the hospitals don't have anything to offer either. Once you get to a certain age, just the invasiveness of things is not adequate, and we shouldn't be doing that. And so our job is to get them and be proactive, to prevent things as much as we can, and preserve that independence and enjoy the life. And I definitely believe pain-free. There's no reason to have people suffer. There's lots of options we have without sedation, without aggressive to where their minds aren't there. But these are things that are out there that most of us don't understand or know about until the last minute. There's things that you should look at. One is access to care and the value of that care. And that's a big thing. And that's a push across the whole United States, just the access to it. And so in these assisted livings, that's a big question. What kind of access do I have? Are they putting mom in a bus in the middle of winter to drive across town and sit in an office all day long for an appointment and then have to come back? I know in North Dakota and those places, that's the winter months are tough, and I'm not sure I'd want my loved one doing that. So I would definitely, back to the question, have a family council with the administrator and find out what the expectations are and see if they can meet those things. And sometimes it's not realistic. It's just not. But you need to know that communication and what the options are. It's not good to hold something back and feel like you're not getting what you need. That's harder on Barb and Jean at home, thinking about their mother. Are they getting what they need? That should be a relief to know that they're being taken care of and good things are going to happen and the communication is there.
Awesome. Dr. Morehouse, before we turn it over to somebody else, I do have one Facebook question that's come in. How would you address senior living not being safe right now?
Not being safe? This is some trials in our times right now. For instance, the school systems, you have teachers that are scared and they don't want to go back to work. But the fact is, the stores have to stay open, medicine has to stay open, and we have got to push forward through this. And the way to do it, we know this time and time again from past diseases and illnesses, that we'll understand it as we go along, using proper hygiene, wearing the masks, spacing when we're supposed to space, and do the best we can. The doctor's standpoint, there's two ways to look at it. One is the preventative side, and the other side is okay, we have it, now we can treat it. And that's always how we look at things. And we're being forced to do that right now. We know that there's these outbreaks in facilities across the United States. And so what are we doing now that we have it? And the treatment options are getting better and better. We don't want to send anybody to the hospital. That's a lonely place and it's cold, and that's not where we want our loved ones. And so doing it at home and having these options, the risk is there. The risk is no different than you driving down a busy highway. There's always going to be risks to things, but we can minimize those risks by using proper cleanliness and hygiene and protocols and doing those things. And they're being set up. I know in most facilities that I do go into, they're following it the best they possibly can.
Thank you for that. I know we've got a lot of questions coming in, so we're going to do our best to go through these questions. I want to have, Michael's got some things I know to share a little bit about kind of how we've been proactive with Edgewood and balancing and protecting seniors. Some of those things I know he wants to talk about, but we do have a question that I think kind of ties into that. So maybe we'll start there, Michael. We did have an anonymous attendee, it says, that's the name. It says, with the end of life being something that all facilities are looking at, something that happens naturally, do you have a bereavement program or consideration for family to be able to come and say goodbye during COVID? If you could maybe address that, Michael, and then I know that you have a few other points that you want to make, and we'll do our best to get to all the questions we can. So thanks for sending those in.
Yep. Yes. And the answer is absolutely. So all throughout this COVID experience we've had, we have had compassionate care visits that take place during end of life for all of our residents, and that is across the board in all states that we operate in. Again, it comes with some caveats. Folks coming in are expected to symptom monitor. They'll most likely be escorted from a symptom monitoring station to and from a room. But yes, there is a lot of psychosocial value in families being able to come together at a time like that, and we do allow for that.
Michael, did you have some other topics that you wanted to share, or do you want me to keep going through questions? You can share what you wanted to share, and then we'll jump back into questions if you'd like. Sure.
Just a couple of points I wanted to make specific to, is it safe to move into assisted living now? And I would say, as the chief nurse, yes. If you would have asked me in March, April, or May, I might have raised an eyebrow in wonderment. But I think all of us are in this together, and we have to look at where we've come from in this experience. Back then, the notion of being able to have PPE was up in the air. We were trying to find that. Guidance was limited. And fortunately, we have learned, as Dr. Morehouse mentioned, to work with this, which is exactly what we have done. It's been a grow as we go experience for us, but we have created lots of safety mechanisms and protocols that are in circulation in our communities. On the prevention side, certainly. While we're here, I wanted to make a brief mention on a new opportunity that we put out for residents. And if you have loved ones in senior living right now, I would encourage you to explore this. But our most recent has been with vitamin D3 and zinc supplementation, which has been sort of scientifically proven to minimize the upper respiratory effects of COVID, which is a good idea for all of us. I'm just going to go out there and say that. So that's one of our latest initiatives that we've put into effect within our communities. We have very robust assessment protocols that our nurses are following. Residents who are moved in at a minimum will be evaluated at least once a day by a registered nurse to include their lungs, their vital signs, symptoms of any kind. And we also have a protocol that goes into effect with any symptom that should present, which opens the door, which has been mentioned previously on the call, to semi-loads of support systems that are available to residents in the form of home health, physical therapy, medications, et cetera. And based on condition, nursing involvement with a patient obviously would increase if the situation requires.
Thank you for all of that, Michael. I think there's so many moving parts and pieces all the time, and it's a lot to always consider. And with different states, I know we're trying to answer as specific of questions as we can today. Exactly. With all of that. I know I'm just looking at there's been a couple that have come in. I'm just trying to monitor these the best I can. Dean has asked a question about, and I think this is what you were addressing earlier, Dr. Morehouse, about the question involves us, not the veteran and family. How do we measure what we need in the future now? Is there a checklist available, knowing that changes do arrive? Something to mention that at the end of this call, we're going to be emailing out basically a checklist that we've put together, this group has put together, that basically has some of those questions to ask. And this one's a little bit more COVID specific, so that you can, whether you're talking to somebody at Edgewood or you're talking to whoever it is, these questions might be good to consider as you're learning a little bit about what their policies are. So we do have that checklist available, Dean, that we will be emailing out to everybody. So hopefully that is helpful to you. There was a question as well that, sorry, I just want to find, Brendan had said to Barb, this is for you, Barb, Medicare certified home health care is covered by traditional Medicare. Was she utilizing private pay home care or companion care?
Oh, good question. Because that was a huge factor when we were considering facilities in Cheyenne. There are some facilities that have only a limited number of beds, I understand, that would be for Medicare only. And my aunt was personal pay, but we needed to know that she didn't have to move once her money had run out. And it's that she won't even have to move from her room to a different room. At CR Hills, that transition will be easy. But those were questions. I mean, this is my first time for everything. And I'm the last of 8 kids, and they took care of my older siblings, did all of the work when mom and dad passed away. And so it was a learning process, but they know that there's Medicare patients, and they come in immediately as Medicare patients, but it was an easy transition for us to be personal pay and know that we won't have to go through that transition again.
And Barb, you're touching on something that we actually talked on our first session, which is about Medicare versus Medicaid. And so I think what you're referring to is the Medicaid beds. That yes, we do have Medicaid beds in most of our Edgewood communities. That there's every building's a little different based on how many beds they have available. So yeah, that's nice to hear though that. And somebody else asked a question going through, Kim had, not me, Kim, a different Kim had asked, what advice do you have for family members that have a loved one that needs memory care and assisted living, but will need to apply for Medicaid? So I think a question that I guess I can answer there, and maybe Michael can jump in too, it seems like he unmuted, but is to work with your local community that you're talking with to see how many Medicaid beds they have available, if they have any openings for that. Michael, what are your thoughts on that?
Yes, exactly the same. I think if anybody is anticipating the need for care and the need for Medicaid, that's exactly right. Get in touch with the community. They can point you in the right directions for that. But primarily, you would want to follow this Kim's advice and see what available Medicaid beds are in the building that you're looking at.
And at Edgewood, we are not Medicaid experts, so we often work with, we'll point kind of towards each state department and which department that is in each state. It's Department of Social Services or Human Services, really, because you'll need to apply for Medicaid directly through that agency. But we certainly can try to get you in touch with some of the right people and get the ball rolling to ask the right questions and find out. And again, like the last session, we talked a little bit about veterans benefits. There are a lot of things out there that at Edgewood, we really try to help connect the dots so people can see what funding resources are out there for them. I think this question would probably be for Dr. Morehouse or Michael. Working in home health, are we as providers going to be allowed to continue patient cares at Edgewood? And again, I think that might be different state to state, but I think Michael, I'll let you answer that.
Yeah. Yep, we have always, since the beginning of COVID, endorsed that those visits by an outside subject matter expert are medically necessary, and the answer is yes. All of those services can still continue.
Thank you for going through that. I'm just trying to see. Okay, another question from Dean. We have friends in a retirement community and found out that we can go into their apartment and visit. How has Edgewood approached this change? Michael, do you want to answer that one as well?
Yeah, and again, it would depend on the state. Right now, outdoor visits are allowed in some states. Indoor visits in a large area with people spaced is approved. And in other locations, again, as I mentioned with the compassionate care visits, folks can check in at a symptom monitoring station. In most of our locations, they ask for that to be done by appointment. Visits are spaced apart and scheduled. But again, it's because we're operating in multiple states here, it's there isn't a one size fits all answer.
Right.
Yeah.
One last comment, it looks like from Dean, he had said to enact this change is a new life experience and quite unfamiliar, setting up natural protective type reservations. I think he's just saying that we can see that setting up this new life is very important and understand these changes, just no response. So I think that's definitely, it's moving a loved one into assisted living, memory care, any senior living is always difficult. As Dr. Morehouse said, it's one of the biggest challenges I think that a lot of adult children face. I think I face that a lot with Edgewood, where when you become a parent, you read books, you take the time, but when you become a caregiver for your parent, you don't, sometimes it just gets sprung on you and you don't have all the time. You don't have 9 months to prepare, to read the books, all that. So it's often difficult. People tread lightly and it's hard for so many people. So I think you add COVID on top of it and really some families just aren't sure. They can't see their mom. They're not sure their loved one. I guess I shouldn't just say mom, but they aren't sure how things are really going. And mom might be saying, oh, I'm doing fine. I'm good. And really with COVID, we just are kept distant so much. And that's why I'm thankful we have things like this where we're together on Zoom so we can try to talk about things, try to alleviate some concerns and some fears. Dr. Morehouse, do you have anything? We're getting close to our end of our time here. Do you have anything that you want to add at the end here?
And just one thing that it came up to me is about this transition. And one thing I knew nothing about, and I still have troubles with it, but I watch families struggle with it, is the financial part of it. People don't know the difference between Medicare and Medicaid, and then Medicare Advantage plans and all these things. And I am not an expert on it. And I would tell you 99% of physicians know nothing about that stuff. And most people don't know it until it's thrown on them. And you have some social worker or discharge planner at a hospital telling you, you need to do this and that. And I know it could spend a whole nother time on this, but it's one of those things that it doesn't hurt to go get some advice on some of these things ahead of time. I do know that it disrupts on what to do for your family and loved one. You didn't realize that you had to have certain things, or they have money in a house and you actually have to sell that house and go through all this stuff. No one says anything about this, and didn't realize the government can come in and actually make you repay back stuff up to 5 years. I knew nothing about this, and I didn't realize it until I watched family members struggle with some of this stuff. And so it really does to get educated on it and get some advice. There are some attorneys out there that specialize in these things to help family planning. It really does pay off if you look forward on those things, because no one wants to make a decision like that at the last minute when all these other variables come in. You want what's best for your loved ones. So just something to think about.
Thank you for that very much. Barb, any final last closing comments from you?
That's what we did, is we found an estate attorney and got a lot of good advice. They are free your first meeting, so we made it really long. It was very good advice. We knew what we could do, our options.
Thank you, Jean, or Barb, thank you for jumping on and sharing your experience. I know it's a difficult story to share, and we appreciate your honesty and being open about your experience.
Thank you for having us.
Jean, do you have any final thoughts that you want to share?
No final thoughts, but just a thank you to Edgewood for hosting this session. I think that tells the community a lot, that they care about our loved ones. And thank you to everyone at Edgewood for being there for my mom during this journey.
Thank you, Jean. Thanks to you for getting on and sharing your story. I think it's helpful to hear as many stories, and people can help relate. It helps them relate to what's going on in their lives. Michael, anything last from you that you want to add?
Yep, nothing new other than just to reiterate how important communication is at a time like this, when folks are making decisions, both with your loved one and with the community that you're hoping to place your loved one in. It's huge. And clinically speaking, we're all in this together. We'll get through this. If we adhere to these standards, it's the best way that we can overcome this. I encourage everybody to understand that.
Thank you so much, Michael. Thank you to Dr. Morehouse too. Thank you to everybody on today. Unfortunately, I think we've all realized COVID's not quite going away just yet. One thing we wanted to end on a high note as much as we can today, to share some success stories from some patients. I think everybody's been scared of COVID, and when it gets into a senior living, we just wanted to share some stories and pictures of smiling faces of residents who have beat COVID. And we love these pictures of them with their, not finishing a marathon, but it was a marathon, that they were able to beat COVID. And so thank you all for getting on today. We will be emailing out that questions flyer. If you are a phone attendee and not able to, you're not on our email list, you can always give us a call and we can get your contact information so we can email it to you, or we can mail you a hard copy of the flyer. That's the phone number you'd call is 701-330-2626. Again, that's 701-330-2626. We will be emailing the flyer out, but if you want to get a copy of it and you're not on our email list, we can always send it over to you. Thank you guys so much for being on today. Appreciate all the questions. Thank you to our panelists, Dr. Morehouse, Michael Johnson, Barb, and Jean. Thanks for being on today. Have a great rest of your day. Join us in 2 weeks. Our session number 3 is safety and security concerns on Wednesday, November 18th, again at 12 o'clock Central Time, 11 o'clock Mountain Time. Same Zoom link as you've been using, same phone numbers you're using, or you can also jump on Facebook. Thank you all.